I'm Dr. Ayyappan V. Nair. I specialize in shoulder surgery and sports medicine. Today I would like to speak about sports injuries which are common in cricketers, especially bowlers and while in the process of throwing. So the most common problem while a patient or a player is going to bowl is his position of the hip and the position of the shoulders. It is very important that when a bowler is going through his phases of bowling, that the hip and the shoulder have to be aligned to each other. That means it should be in the same line and it should not be like crossing each other. Any malalignment in the hip and the shoulder during the phase of throwing can result in specific injuries to the spine and also maybe in the shoulder. In the shoulder injuries which are usually common to bowlers, I'll be speaking on cricket injuries, especially which happen to the ones which usually happen to the bowlers. The most common injuries which usually happen to the bowlers are something called as slap injuries, the rotator cuff tears, and something called as the impingement injuries. So coming to the slap injury is basically a tear in the attachment of the biceps. Biceps is a muscle of the arm. Even though it's a muscle of the arm, it is attached inside the shoulder joint. And whenever there is a pull to the biceps, the root of the biceps can be avulsed and resulting in a slap tear. So a preconditioning or a conditioning of the bowler is very important, and a proper coaching technique of bowling is very important to avoid these kind of slap injuries. Definitely all these slap injuries can be treated, but the first line should be prevention. And if at all a patient or a bowler develops a slap injury, we definitely have different techniques of treating it. That one would be an arthroscopic technique, or where we introduce a camera inside the shoulder joint and repair the slap tear. And patient usually return to sports in a matter of 6 months. Okay, which this follow-up phase of the surgery involves intensive physiotherapy, which lasts for almost 6 months, and then the player is back to playing. The second would be a rotator cuff tear. Rotator cuff tear usually again happens because of a sudden pull or a sudden muscle contraction or even a fall on an outstretched hand, causing a tear in the muscle which helps in lifting of the shoulder, called as a rotator cuff. Certain rotator cuff tears which are very minimal heal by themselves, and others which are quite extensive require again a surgical repair, okay, where we repair the torn tendon, that is the rotator cuff tendons, and it's an absolutely a good surgery. Means okay, the patient usually have very good function after that. And then the last I would like to mention, especially in cricketers, impingement. Impingement is basically rubbing of one bone against another bone. So in the shoulder joint, we have different structures like the coracoid process, the acromion, and the ball socket, that is the humerus and all that. So when the humerus, that is during the rotation phase, when the patient is bowling or the bowler is bowling, during his phases of rotation, especially when he is actually rotating his hand overhead, there are chances that there is a structure inside the shoulder called as a labrum, and there is another structure called as a rotator cuff rub against each other, and we have a condition called as internal impingement. So this again requires a diagnosis. That means we really have to pick it up while examining the patient, and maybe it might require certain investigation like the MRI, but definitely it is a correctable or a treatable condition. The next is something called as subacromial impingement. Subacromial impingement would be when a person is trying to lift his shoulder through something called as an arc, like this is an arc. So if he's got pain in something called as a mid arc, starting around 45 degrees to going up to around 120 degrees, so that's called as a painful arc. That is a sign of this condition called as subacromial impingement. Again, because of the rubbing of the different bony structures against each other. This is a condition which should be treated conservatively, and it should not be actually treated by surgery or any other method. and physiotherapy and extensive physiotherapy, strengthening of the back muscles, and maybe a few injection shots will suffice to treat this subacromial impingement. And then the last part of the impingement is a condition called a subcoracoid impingement. Here the patient usually complains of pain in the front of the shoulder, and again with pain usually happens when he crosses his shoulder in this particular position. So this again, okay, is a condition treated conservatively and with definitely very good results. So I think I've kind of summarized, okay, a few points of cricketing injuries and how this can be avoided. Thank you.